Well,
So, yeah, I'll hand it over to Jillian. And yeah, I really am. This is a very interesting part about long-term challenges that HR leaders should be cognizant of.
thanks, Janani. And so now we'll discuss the challenges, or otherwise said, what's keeping you up at night? And these challenges have no straightforward solution at the moment. They're going to take longer to address and will need more collaboration, innovative ideas, and discussion. And the three top challenges that we identified based on the interviews were employee access to the mental health care system, increasing employee awareness, and defining and measuring success. So first, let's recognize mental health is a very wide spectrum. Some employees just need a day off, others need to speak with a mental health professional. And it's widely acknowledged that even before the pandemic, there has been a shortage of mental health care professionals. So be aware that you can increase your employer sponsored mental health resources and spend and increase your budgets, but that doesn't guarantee employees access to treatment. It's also recognized that you are not a therapist, and neither are any of the managers or your coworkers. So when designing a total reward strategy and this total reward strategy, recognize that part of the root problem, which is the shortage of providers, is beyond HR practitioners' control. What is in your control is mitigating the barriers to helping employees access treatment when they need it through work design, and have an awareness of the access challenges that employees are struggling with, so you can work with your EAP and healthcare providers to mitigate those barriers as much as possible. Consider how managers can work with employees on making space in their work schedules or shift picking that allows them the ability to go to an appointment. Or if an employee needs a quiet place to have a telehealth appointment, is there a private area in the plant or in an office that the employee can go to? If there's unused computers or iPads, could that be plant designated for a telehealth appointment? Because not everyone has and can bring these devices to work. Another idea that came up in interviews is consider auditing your EAP and health insurance to better understand what access looks like from their perspective and from the employee perspective. So what's the average appointment time? We've heard of EAP vendors offering guarantees on appointments within certain timeframes, or vendors hiring mental health professionals directly rather than contracting out. Unfortunately, this has and will continue to be a long-term problem that needs more collaborative solutions. The next is increasing awareness. So, regardless of company size or the type of organization, we heard across the board that engaging with employees about their benefits and the resources was very challenging. And as we know, people typically don't listen or don't take note of what resources are available until they need them. When employees remain unaware of the different benefits available, there's a plateau in resource utilization. Then there's a disconnect between actual employer efforts and perception of those efforts, which results in low engagement scores and inaccurate surveys. Increasing communication is not the answer. We've heard over and over again that employees are struggling with digital overload. So consider focusing on the idea of approachability and evaluate the accessibility and navigational ease of your benefits information. To share some ideas that surfaced, consider creating a very, very easy to use benefits website where employees can go to the website, type in their symptoms that they are experiencing and an item that they're struggling with, and a list of resources pop up. Often they go to these websites and don't know what to look for. Or have a network of mental health allies that employees can go to for questions. Consider how approachable these individuals are and how they can connect with employees in a private place, not a busy cubicle. You could place QR codes in very private areas like restrooms or break rooms that link to benefits resources, and explore all cross-functional communication channels. If there's an engagement-related event going on, can you get a manager to attend? Role modeling can increase attendance as well. Taking communication into existing resources that are beyond HR communication channels can be helpful, but it doesn't solve the problem. We heard some good success with it, but it's not a one size fits all. There are a lot of good ideas, but no one magic solution. And the last is, how do we define and measure success? What does success mean when the concept of well-being itself is a broad spectrum that is highly subjective? How do you measure if the baseline is subject to change and differs depending on where a person is within this wide mental health spectrum? What outcomes are you trying to achieve? I could go on with divergent questions on this topic. We heard so many different approaches. So I'll share some pros and cons for using some of the standard metrics that leaders reported using. You can track EAP and resource utilization and engagement and participation in wellness-related initiatives. But be aware that utilization rates could also be a lagging indicator of success. If use is high, is there a systemic problem within the organization? If it's low, do you just have a really healthy workforce? Engagement also doesn't translate to solutions, which is access and help. Employees can be identified by looking holistically at, trends can be identified by looking holistically at health, pharmacy, EAP, disability claims data. The challenge is that this data is only available in certain countries, and claim variables differ widely depending on whether the employee is in a public or private healthcare system, which differs globally. There's also a lot of privacy concerns to be aware of. Exit interviews and engagement or poll surveys can be a good way to measure perception and success. Yet, fear of employee retribution always hinders survey accuracy. Broadly, we all want the same outcomes. You want to make the business case for your strategy, and you want employees who are healthy, productive, and engaged. So far, there's no consensus about a magic metric to achieve this.